I'm Douglas Massi, and in this brief video, we're going to give you a side-by-side comparison explaining the primary differences between Medicare and Medicaid, which should speak to you if you're A, a potential Medicare or Medicaid recipient, B, if maybe you're helping out a loved one with their Medicare decisions and are maybe trying to figure out which route they can qualify for, or C, if you're an insurance agent that is, well, maybe trying to help out one of your clients. And sure, now would be a great time to give this video a thumbs up and subscribe. We're putting out new content just like this every week. Let's start with some important differences between Medicare and Medicaid. First off, Medicare is for anyone who's 65 years old or older and has worked here in the United States and paid taxes for at least 10 years. Or if under 65 years old but has maybe been disabled for 2+ years or has ALS, Lou Gehrig's disease, or maybe suffers from end-stage renal disease, otherwise known as ESRD. To qualify for Medicaid, you can be any age, but you gotta have a limited income and really very limited resources. To be on Medicare, income is never gonna be a factor of eligibility. With Medicare, it doesn't matter where you live in the United States. The rules are all exactly the same. However, Medicaid is a totally different story. You see, they're both funded differently. Medicare is federally funded and operated. Meanwhile, Medicaid is funded by both the state and federal funds, and it's administered from each state completely separately. So the eligibility criteria for Medicare is the same throughout the country, while with Medicaid, the Medicaid eligibility, those requirements tend to vary from state to state. Interesting enough, Medicare is called Medicare no matter what part of the country, no matter where you live in. But again, Medicaid, well, Medicaid may actually be called something different in your state. I like to give an example. If you live in California, it's called Medi-Cal. Meanwhile, if you live in South Carolina, it's called Healthy Connection. So keep in mind, guys, there is a good chance that Medicaid is called something completely different in your state than it is in mine. Another big difference between Medicare and Medicaid is that Medicare, well, the thing is, it does not cover long-term care. Meanwhile, if the beneficiary is on Medicaid, just the opposite. Once again, long-term care is covered no matter what state the recipient lives in. As far as commonalities between Medicare and Medicaid, they both cover all the doctor visits, including like specialists, outpatients, services, hospital visits, medication, labs, x-rays, and they both tend to be a little complex when it comes to how they work. Let's start with Medicare first, as it's probably the most complicated to understand. Well, no, definitely. Medicare has 4 parts. Again, as long as the beneficiary has worked and paid taxes for those 10 years, or 40 quarters is how it's written in the guidelines, they will automatically qualify for Part A without having to pay any type of premium. If for some reason they haven't quite worked the whole 40 quarters, there will most likely be a monthly premium which will be based on how long they worked and paid into the Medicare during their working parts. Did I say working parts? I meant working years. Part A covers all inpatient hospital visits, including like nursing homes and acute hospital stays. One of the many misconceptions about Medicare is, well, how folks tend to expect everything to be paid for once they have Medicare. Sorry guys, this is not how it works. If you end up in the hospital, you will have to pay a deductible of $1,408 along with another $300 to possibly over, anywhere from $300 to over $700 per day for those long hospitalizations. Part B covers all the outpatient services, doctor visits, x-rays, blood work, and labs. tests and medication given in the doctor's office, some of the home equipment and that you may need it, if you end up at home needing help. Home health, nursing, physical therapy, and occupational therapy too. There is a monthly premium for Medicare Part B, which goes up every year, just about every year. In 2021, it was $148.50, and in 2022, we're looking at I'm pretty sure it's the largest increase we've ever seen. The premium is going to be $170.10. With Medicare Part A and B, if left the way they are, it's what we call original Medicare, otherwise known as a fee-for-service, which means that everything the doctor recommends is billed separately and Medicare will pay for it. Interesting enough, and partially due to the doctor's office's history of overbilling, Medicare Part C was created. Medicare decided, well, hey, if an outside insurance company is willing to cover, and pay for and take care of Parts A and B, you know what? If they're going to do that and pay the monthly premium for the Part B, then they can cover the costs. And now we have Medicare Advantage plans, which is great. And I say that because these plans, what they do is they bundle all the services that are normally paid for by Medicare, again, Parts A and B. But in most cases, will actually cover more than original Medicare, like, for example, vision, hearing, dentist visits, and some of the plans even pay the money back, or I should say part of the money back to the beneficiary that they have to make for that Part B monthly premium. This is known as capitated services. From Medicare's perspective, the idea of having and allowing Medicare Advantage plans is to incentivize the doctors and the hospitals from, like prescribing potentially unnecessary, maybe tests or services to the patients, and only prescribe what is pertinent, what's necessary. For the patient or beneficiary having a Medicare Advantage plan, Part C can often save them a lot of money, including lower to no premiums and co-payments, compared to what is offered through original Medicare. Unfortunately, just like the hospital deductibles and daily costs mentioned earlier, there are a lot of other potentially expensive fees that the beneficiary is at risk for, if they only have the original Medicare Parts A and B. Thankfully, and this is important, many of these costs are often taken care of by having a Medicare Advantage plan, which is also known as Part C. To make things more complicated, there are only certain times of the year that the beneficiary, the recipient, the Medicare recipient, can switch from original Medicare to a Medicare Advantage plan. Usually 3 months before the recipient turns 65 and has access to their original Medicare, to like 3 months after their 65th birthday, and also during annual enrollment and open enrollment. So you're looking at several different times of the year. And open enrollment, which is really when you start seeing all those Medicare Advantage commercials on TV, that's when all that happens, right around the holidays. And then there's a Medicare Part D, which will cover the prescription medication costs and drug benefits other than what is prescribed in the hospital, because that is actually covered by Part A. And if the doctor is giving any medications, then those are covered by Part B. Just to be clear, if the beneficiary is, or the Medicare recipient is on original Medicare, having both Parts A and B, they are not covered for prescription drugs, as original Medicare does not include prescription medications. The beneficiary will have to either purchase a Medicare Part D drug plan through an outside insurance company, or have the Medicare Advantage plan that covers, the prescription medications. An overwhelming majority of our insurance clients and, the folks that we deal with here in Florida have, and we see this more than anything, have a Medicare Advantage plan over a Medicare Part D prescription drug plan. Reason being, there's usually no real advantage of paying extra money for that Part D plan when Medicare Advantage will do the same thing And as I mentioned earlier, often a lot more will give you more insurance without having to pay an additional upfront monthly premium. With Medicaid, things are a lot simpler to understand. Once a beneficiary is eligible for Medicaid, for this program, there are no monthly premiums, and there are very few, if any, and limited co-payments, if any. Now, you may have to pay a very small co-payment for like medication and possibly other things, but what I've learned is that's all based on your state. It varies from state to state, but it won't be more than a few dollars. That's the good news. In most states, you won't pay anything. But remember, guys, Medicaid, the way it's designed to work, it's specifically for people living at or below the poverty level. Therefore, it's affordable for all. However, in some cases, the recipient can qualify for Medicaid even if they are above the poverty level. And that's kind of rare, but it does happen. And in these rare cases, well, there may be higher payments. Of course, it makes sense. Premium payments required for those certain individuals in certain states. For those beneficiaries with both Medicare and Medicaid, any premiums for Parts A and B will most likely be covered 100%. Once again, completely covered by Medicaid. And if this is the case, a good Medicare Advantage prescription drug plan, what we call an MAPD plan, could actually cover all of this and even more, including like additional stuff like gym memberships and maybe rides to your doctor visits, which is great for those of you who are watching this video and you're watching this to try to help a loved one. I'm sure that you can see how, well, this can help to keep them safe in their older years. If you're an insurance agent and would like access to our free Medicare Advantage exclusive leads and advanced training platform, just email me at doug@ufesonline.com. Remember, when you put the needs of your clients first, everything else will usually fall right into place. Now get out there, guys, and do something good for someone today. Happy hunting.